My veterinary background is that I grew up in Colorado, and so I naturally went to Colorado State University, which had some coursework that sort of appealed to me, and I'd never lived in Fort Collins, so that had some appeal too and turned out to be a great thing. And following my undergraduate work there, I decided to proceed on to veterinary school. I loved animals, and veterinary school always had some appeal to me. I graduated in 1981, and then I did an internship at Cornell University in Ithaca, New York, which is one of the coldest places on the planet. And after that, I went back to CSU for my surgery residency. It was a 3-year residency. I finished that in 1985, and then I spent a year in private practice south of Boston. I'd never lived in a big city before, so I wanted to do that. And after about a year, a position in small animal soft tissue surgery became available at Tufts, and I jumped on that, managed to get that position, and I've been happily at Tufts since 1987. My specialty area within veterinary medicine is soft tissue surgery. And the term soft tissue surgery for us implies surgery of all types except orthopedic surgery and neurosurgery. It's what in human medicine they would call general surgery. And within soft tissue surgery, what I like the best really is surgical oncology for a few reasons. One reason is that most animals that have cancer and need surgery are older animals, and the bond between the animal and the owner is very strong. And that makes the whole experience very good for the veterinarian, especially if things turn out exactly like we want them to. The second reason I like soft tissue surgery and surgical oncology is that the expectations of the owners about our ability to treat cancer or make patients that have cancer better are realistic. So whereas an owner might expect a dog that has an itch for some reason to be cured, or a dog that has a broken leg to be cured, when it comes to cancer, they understand that cancer is bad, so they tend to have very realistic expectations about what we can do, and that tends to be helpful to us and sort of sets us free to do things that we think push the envelope a little bit. And then finally, surgical oncology requires creativity. It requires us to be able to do surgery in various body systems on just about every organ or area in the body you can imagine. And that means we have to be more creative, we have to be a little bit more aggressive, sometimes we have to take chances that we wouldn't normally take. And all of that, plus the need to do reconstruction oftentimes after cancer surgery, makes surgical oncology very interesting. My courses are really aimed at general practitioners at all levels. So I go over some procedures that are good for people that are just out of veterinary school and just gaining their confidence in surgery in general and just want to start improving their technique. Included there are very basic procedures like oral hematoma or canine and feline castration, for example. Then there's a wide variety of procedures that I sort of call mid-level procedures, procedures for people who are maybe out of school for several years or beyond and who want to improve their comfort level and just improve their basic technique with sort of mid-range procedures like splenectomy or intestinal surgery or cystotomies and other urinary tract surgeries. And then finally, there are procedures that I include that I think are really geared towards people who are very good at surgery, not necessarily board certified surgeons, but very practiced at surgery and very comfortable with it. And in there are procedures like liver lobectomy and total ear canal ablation and others. There are really two main reasons in my mind why veterinarians might want to consider these courses. The first is under every surgical procedure that I talk about basic care for the animals surrounding surgery. So I talk about the pathophysiology of the disease, clinical signs, the types of dogs or cats that are affected, diagnostic tests such as blood work and imaging, issues regarding surgical decision-making before the surgery is done, things the owner ought to understand about the surgery and its possible outcome, and then finally aftercare for the animal once the surgery is done. The other reason I think these courses are potentially useful is that for each disease or each procedure I talk about, I show a video of the actual procedure narrated by me as it's being done of the surgery in an actual patient. So unlike many ways we use to teach people how to do surgery, For example, text in textbooks or drawings in textbooks. These show the actual surgery, what it really looks like. And as I narrated, I point out places that are key steps in the surgery and all places and other places that you need to try to avoid to keep things from going wrong. So those, I think, are some of the benefits of the courses. Well, I first learned about Vetacademy a few years ago when I was looking around on the internet, just trying to learn what people were doing in terms of technology-based continuing education for veterinarians. And I now know them as an excellent CE organization who has a tremendous amount of very good technology-based content. Well, the most unusual animal I've ever worked with, at least for me, was a moose. He was a moose that somehow wandered down from up north, maybe Maine someplace, and into central Massachusetts, and he got sort of picked up by the animal control people who brought him to Tufts because he was lame, and he turned out to have a fractured humerus. And unfortunately, the day the moose came, neither of our orthopedic people were there. One was off on vacation, I think, and the other was maybe at a meeting. I don't really remember. But I was the only person there who had any idea how to fix a fractured humerus. So I went ahead and did it. We put a bone plate on the moose's humerus and then gave him back to the animal control people, and off he went, hopefully to have a happy, normal life. So that definitely gave me an appreciation for what large animal people do every day. A moose is a huge creature, and it did give me a little bit of appreciation what it's like to work on animals like horses and cattle and so forth.